While working a patient, they might have return of spontaneous circulation. If they have return of spontaneous circulation, then you want to recognize it by recognizing breathing, or if they have a pulse, if they get a blood pressure, or they have an increase in their PCO2. Next thing you want to do is oxygenate and ventilate at a higher level. You want to maintain their PCO2 at between 30 and 40. You don't want to hyperventilate, and I want to oxygenate to maintain an oxygen sat of at least 94%. The next thing I want to do is treat hypotension. If they have a blood pressure systolic of less than 90, I want to give them 1 to 2 liters of normal saline. If that doesn't correct the issue, then I will give them 2 to 20 micrograms per kilogram per minute of dopamine. Or I want to give them 2 to 10 micrograms per kilogram per minute of epinephrine. I next want to consider my H's and T's. I want to know if they were hypoxic. I want to know if they have hypotension. I want to know if they are hyper or hypokalemic. I want to know if they are acidic or have hydrogen ions, or if they're hyperthermic or a temp of less than 95 degrees Fahrenheit. The next thing I want to go to is my T's. I want to know if they have toxicity, such as a heroin overdose, if they have cardiac tamponade, if they have muffled heart tones, or tension pneumothorax, which would be JVD or tracheal deviation. And then I want to know if they have coronary or pulmonary thrombosis. Once I rule out my H's and T's and correct any issues I find, I'll do a 12-lead ECG. If I see any signs of an acute myocardial infarction or any kind of elevation, then I want to identify those and provide that information to the receiving hospital. I would then want to consider temperature management to prevent them from becoming too hot. I want to expose them. I want to flow cold fluids. I want to initiate active cooling, and then I want to transport to an appropriate facility.